Yeah, thanks for
Um,
your time. First of all, can you summarize what these new guidelines are saying?
um, Essentially, the American Academy of Pediatrics has capitulated to politics. They are essentially promoting the lie that children are born transgender, cannot change, and that this is healthy and we need to back them up.
One word used a lot in discussing transgender identity is gender dysphoria. Can you explain what that is, doctor?
Sure, gender dysphoria is real. It's an upset, an emotional disconnect with your biological sex. And fewer than 1%, less than 1% of young children may experience this. But the key is if they are supported through their natural puberty, over 80% will come to accept their biological sex by late teenage years.
Are children mature enough to make these decisions when they're in their preteens and teen years?
Absolutely not. I mean, this is, first of all, there's no rigorous science to say that anyone is born this way. In fact, twin studies tell us the opposite, that this is this confusion, this problem in the mind is due to psychological issues, family dynamics, socialization. You are now dealing with children who are ages 8 to the teen years. There's reasons we don't let them drive cars, we don't let them vote. We Why? Because they are not cognitively mature. And yet these gender activists in the AAP are trying to tell us that 8-year-olds, 9-year-olds, 13-year-olds are mature enough to decide whether or not they should be infertile for life, whether or not they should have a double mastectomy at age 13. This is pure insanity.
Is there anything that you find concerning regarding the new guidelines?
Well, I think we pretty much just summed that up. I mean, when when modern medicine sacrifices the health and wellness of children on the altar of political correctness, I mean, in the case of these kids who are confused about their biological sex, we are sentencing them to a lifetime of sterility, and really surgical mutilation, not to mention all of the serious side effects that sex change hormones have, namely risk of heart attack, high blood pressure, strokes, even some cancers. So, yes, it's very concerning. And the American College of Pediatricians stands as an alternative pediatric organization, one that truly puts the health and well being of children ahead of politics.
The Academy, doctor, says that it established these guidelines in part because of the number of suicides among youth who struggle with gender identity. Do you think this is the route to go? I mean, you pretty much declared your position on this, but maybe talk a little bit more in relation to the number of suicides.
So, true that suicide is more, the rate of attempting suicide is more prevalent among children who are confused about their sex. However, there is no proof that the same underlying cause for the gender dysphoria, the same underlying cause for that confusion about sex, could also be triggering the suicide. Um, so that's number one. The academy is just assuming that, oh, they're feeling suicidal because no one will affirm their confusion. Now, you can't assume that in science. The other thing is we know adults who transition, their suicide rates do not decrease.
Okay. Dr. Michelle Cretella, thank you so much for your insights today.